Hi everyone, I'm Dr. Karam. I'm a board certified facial plastic surgeon and I specialize in facial rejuvenation. And today we're going to talk about a very important topic, a question that comes up all the time. And that is it necessary to perform a fat transfer in addition to facelifts or other type of tightening procedures? Let me start off by saying this. The aging process consists of three columns of changes, three verticals. So think about it this way. On one hand, you've got changes that are happening to laxity. Laxity is the things that affect the shape of the face. So you've got the corners of the brows that come down, you've got the mid face that starts to encroach on the nasolabial folds, and you start to get heavy across this area. You start to see jowls as the jawline starts to come down, and then this is where you start to see the heaviness happening in the neck as well. So this is all the fascia starting to get longer, the face is starting to get longer, and as a result, the shape of the face goes from being like a heart to a rectangle. And sometimes you can think about it as like an upside down triangle during youth and being more or less square as we get older, as those jowls kind of set down and we lose the definition of our jawline. So those are structural changes that are happening. In the middle of the face, the laxity is starting to affect the upper eyelids. It starts to get a little bit longer. We get the heaviness on the eyelids. On the lower eyelids, you start to see excess skin and sometimes bags. On the lip, you start to see the lip get longer. So all of these things are happening. They're lengthening, right? So that's column number one, or think about it as, gravitational changes for simplicity. So then there's a second level of changes that are happening. And that is, we're starting to lose volume. The facial fat that covers the bones and gives our face softness and fullness and gives us that refreshed look, that begins to dissipate in certain areas of the face. Where are the common areas? Well, the most common areas are around the eyes. What you see is there's a hollowness that starts to set in underneath the lower eyelids. Above the eyelids, underneath the brows and above the eyelid, there's a hollowness. So the orbital socket becomes more bony looking. If you look at the temples start to become concave looking. This is the periorbital region, but there's also other areas of the face that have fat pads that start to lose it. Sometimes people lose it in the mid face. Sometimes they lose it in the outer portion of the cheek. Sometimes they lose it in the portion of this triangle here we call the precanine fossa between the nose and the lip. There's a fat pad there that starts to diminish. There's also fat pads in the actual lips, and there's fat pads around the chin. All of these areas, to some extent or another, begin to lose volume as we age. And as a result of that volume loss, the face starts to look more gaunt, starts to look more collapsed, starts to look more hollowed, and ultimately looks more tired. That's the effect that volume loss gives you. If you were to think about the laxity changes giving you change in facial shape that's consistent with an older looking face, changes related to volume loss give you a hollowed or more tired or less healthy look. The third column or vertical is related to changes that are happening to the skin. So changes that happen in the skin is skin loses collagen, loses elasticity, it loses the bright glow that you see in youthful looking skin. And when that happens, the skin starts to look dull, it starts to look lined and wrinkled, it starts to begin to look more discolored. And these are changes that are happening in the skin, and that's a separate level of changes. So there's three things that are happening during the aging process. Changes to the skin, changes to volume, and changes to the laxity or the lengthening of the fascia of the face. My approach has always been to combine treatment of all three of these areas. Specifically speaking, I almost always treat the volume and laxity at the same time. So let's review real quick. Let's kind of give a little perspective here. So let's say you are in your 30s, early 40s. You don't have any laxity at all happening in your face. Jawline is nice and firm, neck is firm, everything looks good, but you're starting to get hollows into your eyes, your face is starting to deflate a little bit. Those are changes that typically do happen around the late 30s, early 40s. In that case, you're a perfect candidate for just a fat transfer by itself. Now, let's say you are in your late 40s, early 50s, or it could be any age really, but let's just say typically in that age range. You start to see laxity happening. Now you say to yourself, geez, I don't really want to have a facelift. I don't really want to have, an invasive surgical procedure. I just want to go have a fat transfer. Well, guess what? If you get a fat transfer in that condition where you have laxity, you're not going to see the changes because the principal problem is laxity when it exists. It's the number one priority of correction, because when you start to put fillers or fat or any other type of procedure in a face that is beginning to change shape because of laxity, what you end up doing is putting volume in areas where the soft tissues aren't where they normally should be. So you're putting, fat, say for example, along the cheeks or etc., but yet the facial soft tissue is down here, and you're putting it here. The face looks distorted to some degree. It doesn't even look quite corrected. So here's the rule of thumb. If you have laxity, the treatment always needs to involve a surgical procedure. So in my practice, as many of you know, I perform a trademark procedure that I developed called the vertical restore that treats all of the laxity of the face at the same time. But I almost always, 99% of the time, will include a fat transfer in addition to the vertical restore for this simple reason. My goal is to make people look like they used to. Again, when you were younger, you had volume and you had a firm facial shape, right? You had a youthful facial shape. So when we're trying to restore you back there, well, obviously, it's not going to be enough just to get the shape back up. We want to be able to add the volume to correct those hollows around the eyes, etc., and get that kind of a change. So it's, in my opinion, very, very important to combine the treatment of volume and surgical repositioning of the soft tissues to get a truly rejuvenated look. Now, let me set a quick caveat to all this. Everything that I'm saying is based on my approaches, my techniques on how I do things. I do a vertically oriented deep plane approach called the vertical restore. So that really does put the soft tissues back to where they were, compared to conventional facelifts would pull the face sideways. So that the concepts are a little bit different. I think where you would put volume, where you would, handle it would be a little bit different in a traditional facelift, but the concept still is the same. You're losing, facial position, you're losing facial volume, so it makes a lot of sense to bring those two together. So where does skin fit in? Well, skin is ubiquitous. You want to always address the skin one way or the other, whether it's preventing it from aging using the right products, sun protection, etc., or at the time of a procedure, if you have a lot of sun damage and wrinkles, etc., you want to use a laser resurfacing or chemical peel to improve the skin quality, and then move forward being on the right products and sun protection, etc. But bottom line is, you can't treat laxity with volume alone. You can't treat volume loss with surgery alone. The combination is important, but in the cases where you have laxity, always, if you're going to pick one, always treat the laxity first, because that's where you're going to get that youthful facial shape that's really important. And then the fat transfer becomes a beautiful icing on the cake, but by itself, it cannot stand alone as an anti-aging surgery or procedure unless you have no laxity and you're younger. And that's the candidates who would get a fat transfer alone. So I hope that helped kind of bring things into perspective on why these things kind of go together, why I generally advocate the use of fat transfer and my vertical restore or facelifts. And that should give you a little bit of perspective of why not do a fat transfer alone. The combination treatment to restore the youthful facial shape and volume is the key to a natural, beautiful, harmonious outcome, which is basically what we all want, right? We want to look like ourselves like we did back when we were in our 30s, etc. The pictures, I guess, are worth 1,000 words, but I'm trying to give you a few words just to put things into perspective that makes it easier to understand why those changes are happening and why we approach it the way we do. So again, if you have any questions at all, hit me up on the comments. I'll do my best to answer as many of them as possible. If you haven't already, hit subscribe so you can get more educational videos like this. If you have friends and family who would benefit from this type of information, share it, pass it along, like it, so we can get more people to see this. And again, it's my pleasure to share these videos with all of you, and I look forward to the next one. Look out for them on a weekly basis. You're going to get videos like this on our YouTube channel. Thanks again, Dr. Karam.